Hey, I'm Kristian. I'm the CEO and one of the co-founders of Meru Health. Meru Health is a lifestyle medicine clinic treating depression, anxiety, and other mental illnesses.
Excellent. Thank you for joining. Tell me a little bit more about the clinic, what that looks like. People think of clinic, they think of a bricks and mortar thing. We're here at Health and talking about innovation. How does it all fit in?
Yeah, sure. So we're a virtual clinic, so we operate in the cloud or, virtually. We have real providers, real human beings, and we operate in every zip code in the US, so across the whole country. And yeah, we have providers that use technology that we've built, a patient-facing app, plus a wearable device for biofeedback. Plus then, just like being able to chat with providers, being able to do video calls with the provider. So there's some back-end technology and then some patient app technology.
Interesting. And so what are the types of primary healthcare that's delivered through the clinic?
Yeah, so we focus on like depression, anxiety, PTSD, bipolar, like some of the mental health conditions that are like most largest volumes out there. And we're like more even geared towards like moderate to severe range of the spectrum.
Interesting. And so who are the types of patients that are engaging with the clinic? Like how do they come across the services you provide?
Yeah, so we work with a lot of health insurance companies like Cigna's, Aetna's, United, others. And we kind of, with them work through like some of their channels. So patients can find us through like provider searches or through like member portals. But we also like then do proactive outreaches with our marketing team where we may communicate to like, employer populations or other at-risk populations in collaboration with the health insurance company.
Got you. We're definitely like the mental health crisis globally is apparent. We're not short of different innovative ways that are trying to address the issue. So walk me through some of the thinking on like why the clinic exists and how it can provide some real impact.
Yeah, well, yeah, sure. So maybe first of all, I founded the company back in the days, unfortunately, after having lost my brother Peter to suicide. And my brother Peter was actually getting care. So we have a problem with access to care. Like that's something which is very much known in the mental health space, that people just can't get access to care. There's not enough providers, stuff like that. Yeah. But actually my brother was getting access to care, but he was not getting better, he was getting worse. So when I started thinking about founding the company after I sold my last company, which is in diabetes, I really dug deep into the literature and understanding what's really working and what's not working in mental health care. What I realized that in addition to the access problem, there's a huge efficacy problem. Like a lot of the treatments don't really work for a lot of people actually. So we're just, doing things that are ineffective or not a high quality of care. And that's when I started thinking about that, we got to do something different. And that's why I came up with the idea of more of a holistic or lifestyle medicine approach, where we not only do therapy in a traditional sense, but we also address diet, sleep, exercise recommendations, and then we also have a biofeedback wearable. So it's kind of a different way of thinking about mental health care, much more holistic. And what we are seeing now is roughly 2 times better clinical outcomes than normal mental health.
Yeah. I guess that's a better, a capability you have by doing a lot of things virtually is the amount of data that you can then capture, I guess, in real time or through all the different transactions. That's interesting. You've incorporated the wearables into that too.
Yeah.
So is that how you kind of make some of those informed decisions in terms of the efficacy of the treatment that's provided, is looking at some of the indications provided back through all the different data points that you get back through?
Yeah, so absolutely. So the richness of data is really important as part of us understanding our patients and how do we work with them. But we also collect, use gold standard measures like PHQ and GAD, PHQ-9, GAD-7 at the onset, so at the baseline, and then every 2 weeks we collect those data points, and we display that to the treating provider, but also to the patient, but so that they know, hey, am I making progress or not?
Yeah.
And then additionally, we have a lot of physiological data points, like HRV, biofeedback data points, coming in from the wearable, which gives us an additional lens into understanding how the patient is making progress.
Yeah, interesting. And is that information presented primarily to the clinician that's providing the care, or is there any a view for the patients as well?
Both. So we've kind of learned that it's a great motivator for the patient to also see that, hey, I'm making progress. I don't really remember how I felt a month ago, but I can see that I'm making progress. So hey, it's great.
Yeah.
Versus if I now asked you how do you feel 2 months ago, who would be able to tell? I'm
overwhelmed here. I don't know.
Yeah.
Yeah. No, that's great to be able to have that retrospective view. And so you're here at Health. I understand you're up on a stage, is that right? Tell me a little bit about what you were sharing with the group here.
Yeah, so here at Health, speaking tomorrow at a panel talking about like the innovation in mental health care. And like my personal thesis, as mentioned, is that like I think the world needs more effective mental health care, and we need to like rethink how we deliver care from ground up, because like what we're doing today is great, but it's not quite enough for a lot of people. Like again, my brother wasn't really getting better. So that's what I'm here to talk about. And yeah, working with a lot of insurance and just here to meet with people. It's a great venue, great event.
Yeah. And lastly then, so what can we look forward to seeing over the next 6, 12, 24? Like where are your priorities at in terms of innovation growth?
Yeah, so we're excited. We're actually launching some new offerings next year. So we are kind of expanding our offering to like other populations that we haven't served yet. So that's going to be some announcements coming a bit later. We're excited about that. We're going to be sneak peek. We're going to be tackling some of the hardest conditions, and that's something we really want to go to the deep end and help people who are not actually being helped by a lot of other providers out there. So excited about some of those new launches up and coming.
Yeah.